Welcome back to this webinar series around postural management. My name's Richard and I'm the Clinical Training Manager for Jiraffe and for Jenks. So just to give you a little bit of a brief overview of why we've put the series together, really it's a small piece of free training for anybody that's involved in the care of somebody with complex disabilities. So if you're a healthcare professional or a therapist, family member or a carer, there'll be something within this series that will be useful for you. So this is video 4 of a 5-part series. We've already taken a look into why postural management over a 24-hour period is so important, and we've also looked at some of the possibilities of things that could go wrong and the secondary complications that can occur from adopting a poor posture. Today we're going to take a look at how to build a stable posture in seating, in standing and in lying. And then the final video is going to be around some helpful tips and hints about the fundamentals of assessing for posture. Just a little bit about myself. I've been with Jenks and Jiraffe around 4 years now. Prior to that, I spent 8 years working within the NHS in a variety of different roles, working with a lot of people with complex disabilities. So I've got a fair bit of experience assessing people's needs, and I've made recommendations for equipment provisions in seating, standing, sleeping, bathroom and mobility. I also have a postgraduate certificate in postural management for people with complex disabilities. Today's presentation is on building a stable posture. So some of the things that we're going to look at today, we're going to look at what stability is and what makes something stable. So once we understand the principles of stability, we can then take those principles and apply them to creating a stable position in seating, in standing and in lying. So first of all, let's take a look at body composition and how the body behaves. So we're naturally quite unstable. We're actually not very conducive to stability, and we'll look at the reasons why that is in a few slides' time. And because of that, we have a lot of internal stabilizing mechanisms, such as our inner ear for our balance. We're also very flexible, we've got joints that move, and we're very dynamic. So because of this, we're also quite vulnerable to damage. We looked in a previous presentation around secondary complications and the idea of tissue adaptation, which can cause a lot of asymmetries, which makes creating a stable posture much more difficult. So what happens to the body if it becomes unstable? So if we become unbalanced, sometimes that can make us feel very unsafe and not secure. And when we feel that way, naturally our body tenses up. So if that happens to somebody that's already got issues around spasticity and their muscle tone, it can only increase that and make that worse, which may be counterintuitive for positioning someone. So if we don't feel stable, we might sometimes seek support, and we might adopt quite poor postures if we're propping on different surfaces and kind of coming out of our midline position. And because of that, if we are propping quite a lot and having to use our body segments differently to offload weight, then it's going to be more difficult for us to be functional and complete our activities of daily living. So really it's this idea that if that happens, then our whole world will become just staying seated and staying stable. Now, if we take a look at this young man, and if we think about whether or not this chap is stable. So I've got no one to ask because this is a webinar, but I can tell you that he's not stable. He might be balanced. He might be balancing himself onto that left-hand side of his pelvis. He's got one of his arms kind of propped into himself, and then the other arm on his thigh to act as a bit of a counterbalance. So there's loads of issues around that. If this young man adopted this position over a long period of time, he'd have all of the pressure of his body weight going through that one side of his pelvis, which obviously can lead to a lot of pressure-related injuries or pressure-related issues. But more to the point, his whole world is currently revolving around staying stable, and because he's not able to hold that stable position, all of his energy and all of his efficiency is gone on to just staying in that one position. So therefore he's not able to engage in any classroom activities or play with peers or do paintings, writing, that sort of thing. So if we look at the kind of 3 main reasons of why we want to manage someone's posture, first of all, to reduce energy expenditure, which obviously this is not doing, to allow someone to be as functional and as independent as possible. Obviously that's not not the case here either. Now, if we take a look into stability, and there's three main characteristics of stability of what makes an object stable. And those are, first of all, a wide base of support. We need the centre of mass within that base, and that centre of mass needs to be low to the surface in order to make something stable. Now again, this is a webinar, so I can't ask anyone, but do you at home think that this truck is stable? I will tell you, it isn't. And if we look at the reasons why, using those kind of three characteristics, in terms of how high the load is, the base is not very wide. It's also not got its centre of mass within the base, or it might just be within the base, but it's certainly heavily leaning to that right-hand side. And again, because the load is so tall, that the centre of mass is probably quite high within it, so it makes the truck very unstable. Now, if we take a look at this slide, it's a picture of the pyramid. So the pyramid is a very stable object. Obviously, it's got a very wide base of support. The centre of mass is within the base, and it's also very low to the surface. So that's what makes the pyramid so stable. Now, if we keep those characteristics in mind, because we're going to use them now in creating stable positions in seating, standing and lying. But before we get onto that, if we just remind ourselves of the three main aims of postural management, as well as it's vitally important that we know why we are looking to manage someone's posture. So first of all, function. So to allow someone to be as independent as possible so that they can engage with their activities of daily living. Minimize damage, so we don't want any deformities to get worse or to even form in the first place. If possible, we can stop them from forming. And thirdly, to reduce energy expenditure and fatigue. So by allowing someone not to spend all of their energy just keeping themselves stable, they're going to be able to be more functional and do those activities that they need to do throughout the day. Now let's just pinpoint some of the key principles when we're supporting someone in any position. First of all, the pelvis is always the keystone of everything that we do. So no matter whether we're putting someone into a chair, a standing frame, or maybe a sleep system, we always start with the pelvis. And that is because the pelvis always affects what's happening above and below it. So if the pelvis is slightly rotated, it will affect the position of our legs. It will also affect how much our spine's rotating. So it really is the keystone of everything that we do. Gravity should be used in our favour. So we've already looked at gravity and the force that's being applied to us constantly. Now it can actually take up a lot of energy to fight against gravity, especially for somebody with quite complex disabilities. So where possible, we should always use gravity to assist us in positioning. Now, if someone's got asymmetries, it's really important to understand whether that is a fixed or a flexible asymmetry, and we'll take a little bit of a look at this in the next video of how to kind of find that out. And it's really important that we find that out, because what we want to do for a flexible asymmetry is very different to what we want to do with a fixed asymmetry. So if something is flexible and can come back into neutral, wherever possible, we need to correct that so that it doesn't become fixed. Obviously, we need consideration around pain and comfort as well. But wherever possible, we want as aligned and as neutral as possible. If something is now fixed and we're not able to bring that back into alignment, then what we need to do is we need to accommodate that asymmetry so it doesn't get any worse. So now that we know that there is kind of either maybe an obliquity in a pelvis, for example, we might need to think about what kind of seating system that person may need. As the asymmetry may lead to more issues around pressure, we might need to look for more of a contoured shape around the seating system. And also, lastly, in this part, we need to think of function and independence and how that's always paramount over whatever we do. So 9 times out of 10, when we think of postural management, we're actually adding to someone's function and independence. But in some circumstances, it can actually impede that. So usually there's a nice compromise that can be found where we can allow someone to be functional while still supporting their posture. But wherever that can't work, then function and independence should always come first. So in seating, the first thing that we need to do is we need to create that stable base and that nice wide base of support. So we already know as well that the pelvis is the first thing that we need to consider. It's the keystone of everything that we do postural management wise. So we need that pelvis as neutral and aligned as possible. Usually we need to support that at the back of the pelvis around the sacral bones, maybe with a sacral block. Then we may use a 4-point lap strap across the front of the pelvis to secure that into place. So we've got our counter forces against that kind of sacral block. And depending on the seating system that you are looking to use, you may have what's called an ischial well, and that's where the back of the chair, the back of the seat, may have either immersive material, so the pelvis actually sinks into it, or it may be slightly contoured so that it creates a bit more of a ramped effect. And what that does is it allows those sitting bones, the ischial tuberosities, to really sink into place, to be really positioned in a nice neutral position. So now that our pelvis is really well looked after and very stable, we need to look at creating a bit more of a wide base of support. So if you're watching this at home and you're in a seat, I would like you now to stand up. And then if you sit on your chair nice and towards the back, so you get your bottom right to the back of the chair, and just notice how your legs are now positioned. Please don't cross your legs as well, because this would absolutely void the point of what I'm talking about. My point is that we actually sit with around 10 degrees abduction naturally, and that's because we're naturally trying to create that wide base of support so that we feel more stable. If we now sit with our legs in a really, really overly neutral position, so that our knees are almost together, you can kind of feel yourself that this is a little less stable, and that you're having to work a little bit harder in your kind of core to actually keep yourself stable. So if we remember that when we are positioning someone in a seating system, that we need to think about that slight abduction of the legs, just to create a wider base of support. It's also helpful because it aligns the head of femur and the acetabulum a bit better as well. So the other thing we need to do is support the full limb. So we want to support under the thigh for the whole seat unit, and leaving a slight gap so that we're not putting any pressure on the back of those calves as well. So now we need to take a look at the feet. So this is a bit of a hot topic. It's a little bit difficult to have this conversation with some parents, because they may not fully understand why you might want to strap a child's feet in when the seating system might be used for maybe feeding or kind of home activities. I'm going to get you to do another little exercise here. So with your in your chair now, so again, if you make sure that your bottom's right to the back of the chair. Now what I want you to do is I want you to kick your legs forward as much as you can, so they're like fully extended, and now put them back down on the floor. What's now happened to your pelvis? I can't see your pelvis, but I'm going to tell you. It's actually posteriorly tilted, so it's now come forward a bit, and you are in a more of a slumped position. So there's not a 4-point lap strap in the world that will stop that from happening if someone's feet come up. Now, not every I'm not saying that every child will need their feet strapped in, but if a child is unable to adjust their own position and scoot their own bottom back, then it's something that really does need to be considered, because if a child is popping their legs out quite frequently and creating that tilt in the pelvis very often, then it's going to lead to some poor positions of the pelvis. So it's just something to have in your mind of why, again, we're looking for a seating system and what we're looking to achieve by it. Are we looking to make someone more functional and avoid that kind of damage from happening? Then it's something that we might need to have a conversation about. So now that we've sorted out our stable base, we can work up the body now. So if we think of the trunk and shoulders, we want to create stability, but we also need to create movement, because a lot of people have got active movement and we want to encourage that. We want to engage with our surroundings, so we need to be able to twist and turn. However, if we've not got the ability to hold ourselves over midline and we tend to slump to one side over a long period of time, again, that's putting a lot of pressure on our spine, and the effects of gravity bearing down on our head. It will only make that worse over time. So looking at lateral supports, if somebody needs that level of support, something just to keep us into that midline, and the positioning of that support may differ depending on the child or the person using that seating system. So it might be just used as a bit of a prompt in order to stay in a midline position. It may be that child has got very low tone and needs that support in order to stay in a nice aligned position. And also, if this chair is used in a really functional way, but you want to include more of a therapeutic element to help with those achieving those motor skill milestones, then having something that flips away, or you can remove the support so that someone can work on those core stability skills, then it's something again to consider in what kind of seating system that you choose to go for. So again, looking at shoulders, we don't want that slumped position where they're protracted forward. We want a nice aligned position over the spine. I'm just going to point out now as well, as you can see, the white dots on the image here around the pelvis, the knees, and the ankles. So that's really to depict that idea of sitting at a 90-degree angle at the hips, at the knees, and at the ankles. So what a lot of people interpret that as is sitting up bolt upright, which is actually quite tiring after a long period of time. So because our back is not in a straight position, we've got a natural kind of lumbar curve and curve around our thoracic regions. It's perfectly fine to contour that with a seating system, or having the ability to adjust the angle of that so that someone's able to sit back into the chair a little bit more, to offload weight and be more comfortable. That's absolutely fine. If something is not comfortable, it's not going to be tolerated, and the child is not going to be in a happy functional position. So now moving on to the arms and head. So we need to allow as much movement as possible, because like we've mentioned before, one of the main purposes of postural management is to allow someone to be as functional as possible. So being able to come into a midline position, being able to reach and grab and look around our environment is vital. So we really need to consider that when we're positioning children and young people. So the right level of head support is really important, depending on the level of that person's head control. And we don't want to block any vision. We don't want any periphery being blocked, because we want as much as possible to see our environment. So if we take a look at the gold standard of seating and what we kind of look to achieve from a seated position. So we want our feet flat on the floor in plantigrade wherever possible. We spoke about having that slight abduction of the legs to create that wide base of support, so around 10 degrees abduction. We want to support the back of the pelvis around the sacral bones with a bit of a sacral block, and then we need the counterforce of a lap belt or a 4-point harness across the front of the pelvis. We want the spine stacked nicely over the pelvis as well, with a natural lumbar curve. And we want the head and shoulders just aligned over the spine, and all of our joints at 90 degrees. So that's our hips, our knees, and our ankles. We've already discussed how that doesn't mean we have to sit bolt upright. We can be nice and comfortable and allow the seating system to take some of that weight in the backrest. Also, just to point out that if a child's not able to achieve all of these things, it doesn't mean that we can't get an appropriate stable seated position. It just means that we have to accommodate for things a bit differently, and that's completely fine and completely acceptable. Now if we take a look at how to create stability in standing, so if we keep those characteristics again in mind, but first of all, let's just go through some of the reasons why you might want to get somebody standing. So it's really important as well to understand the purpose of standing within someone's therapy program or a postural management plan. It might be, for example, to maintain someone's hamstring length. So in being in a standing fully extended position, it gives the hamstrings a really nice stretch, and it stops those, or it makes it less likely that those deformities such as tissue adaptation and contractures may form. Also, loading, so load bearing is also proven to help with bone mineral density. It's also helpful for hip development and bone growth. So when we're looking to form those acetabulum grooves with our head of femurs, standing is a really big part of that. It also can help with bladder and bowel function as well, so all our body systems working in a nice, efficient way in a different position. And it also helps us with our motor skill development and being more functional for certain activities. Also, being on the same eye level as peers can be really helpful for psychological and social benefits, and to get that body awareness and that spatial awareness. So with that in mind, just to really understand why you might want to get the young person that you're looking after, why you want them to be up and standing. So standing in prone and supine, that's two obviously different things, and there's different benefits from doing both. So you might be looking to stand someone in prone to help with a bit more trunk extension, because having that in a slightly forward leaning position allows for that trunk extension with a bit of anterior support. Usually younger children, where we're looking to really form those hip joints, starting in a prone position, going to an upright position can also be a really good way to start someone in that journey to standing in a completely upright position. Usually you need quite a good sense of head control as well in a prone position, whereas if we didn't have that, we might look at maybe a supine stander, where you have more of the support going through the kind of posterior side of the body, so we can fit more of a robust head support to a supine stander. Also, if there's issues around manual handling, and a hoist and sling might need to be used. Generally being on a flat board without any gaps is a lot safer as well, so things to consider there. Possibly as well for somebody that has got some contractures at the knees and hips, but we still want to get them standing for many reasons that we've kind of gone through around the clinical benefits and also the social benefits. So again, a supine stander might be more appropriate in that situation. Now again, this doesn't particularly differ a lot from seating. It's still the same principle. We first start with the pelvis, and we want to create that stable base, which will happen in the lower half of our body. So we want to support the pelvis as best as we can, so as neutral as possible. We want to support laterally, so some hip guides to really put that pelvis into a nice position. It's really important as well to think of having some quite firm block support there as well, because if someone is able to kind of move position quite a bit around the pelvis, they may be offloading weight unevenly through each side of the pelvis. So having a really robust strap and block system is really helpful for that. Now once we've got a nice level pelvis, we want to be thinking again of creating a nice wide base of support. So it might not be appropriate to stand in a lot of abduction where our legs are really far apart, but at least hip to shoulder width apart creates a bit more of a stable base. We need to be really focused around the knees as well, so make sure that they aren't internally or externally rotating too much, as that will weaken our position. And if there are any contractures or any amount of flexion in the knees, we need to make sure that we are accommodating for that well enough and supporting behind the knee, so that we aren't putting too much pressure through those knees. Again, feet is very, very important. If somebody has any ankle or knee orthotics, those should be worn at this point as well, so that we're not going to risk any rolling of the ankle, so any kind of pronation or supination of that ankle. Also, having a flat foot's really important as well, because we're bearing all of our weight through our feet, that we want as much surface area making contact with the surface as possible to offload and disperse that pressure nice and evenly. So again, working up the body, again, same as in the seating system, we want to support laterally, especially as we have got our whole body in an upright position. If we are leaning to the left or right, it's going to put a lot more pressure on that pelvis and that spine, which can create rotation and could form scoliosis, that sort of thing. So it's really important as well to think of the young person that's going to be in the stander and their kind of condition and needs. So, for example, if somebody had issues with their tone, if it had quite high tone, having the supports a little bit lower around the thoracic region and a little bit less tight can also help with building up those kind of core muscles as well, and being able to engage in different activities and hit those milestones. Whereas somebody with quite low tone who's quite floppy, they may need to be secured a little bit tighter and a little bit higher up in order to keep that aligned position. And again, with shoulders, we don't want to see that protraction coming forward too much if it can be avoided. We want a nice neutral position so that the head isn't coming forward too much or back too much, and that we're nicely aligned over the pelvis. And finally, again, so our arms and head, we need to allow as much active movement as possible in order to be more functional and to engage with our surroundings. So we need to keep that in mind again, making sure that we're not blocking any vision and that we are not encroaching on any kind of issues around engaging with the environment. So just some of the things to consider when putting somebody into a standing position. First of all, head control. How good is their head control? How good do you feel that their head control could be? So that links into kind of the goals and the needs of that individual person. So if, for example, that person doesn't particularly have good head control, but can work on that and feel that could be something that they progress to. Maybe having a standing frame that can do all three things, so being able to be used as a supine stander as well as a prone stander, and also to get that upright position. It might be useful to look at something like that. So the idea of abduction, there are standing frames out there where you can stand in quite a degree of abduction, as there's quite a few studies out there to suggest that it's beneficial for hip formation, but also things like reducing spasticity, and also to benefit someone's gait pattern. So there was a study back in 2015, I believe, in Spain, where they underwent some research with some children with spastic cerebral palsy, and they found that the children that had been standing in abduction, their gait was far less scissored than the group of children that weren't standing in abduction. So muscle tone. So we spoke about those different kind of positions around the trunk of where we might support depending on someone's muscle tone. So whether they've got high muscle tone and low. Orthotics again. So if someone does have orthotics and AFOs, for example, then they should be worn in standing, so to support the ankle joints and the knee joints as much as possible. We also need to be aware of whether we might be inducing hypertension. So if somebody has not been in a standing position for a very long time, or maybe has never been in a standing position, the effects of coming up into that position may cause hypertension. So it could cause someone to faint, their blood pressure can drop. So it's important, if that's likely, to be really aware of that, and maybe choose a standing frame that can come up really slowly and incrementally, and that you can monitor that in the kind of the first few episodes of coming up into a standing position. Also, to just think about the benefits versus the effects, and someone being able to tolerate a standing position. If it's very uncomfortable for someone to be in a standing position and it causes a lot of pain, perhaps it's not the best thing for that person. Maybe there's a different kind of intervention that person would benefit more from. So maybe being more dynamic in a walking device might be something. If it's to do with maybe stretching the hamstrings out, then perhaps maybe different positioning, high kneeling or different kind of supine positioning may be more appropriate for that person. So just to be aware of that. Now finally, let's just take a look at creating stability in lying. So we've discussed seating and standing, so let's move on to lying. Now it is, in my mind, one of the most important positions to consider, and that is because we spend so much more time in lying. So if we're sleeping, we hopefully spend at least 8 hours doing that, And if we're adopting a poor position throughout the night, then that's going to affect everything else throughout the day. So if we're constantly adopting those poor positions in night, it's actually going to have a massive effect on how well we can sit. So as you can see here, one of the points I've got, lie well to sit well. And what that means is if we are perhaps adopting a really poor position at night, if our legs have become windswept, so that means where both knees have fallen over to one side, and if that keeps happening night after night, it might be that we become fixed in that position, so we aren't able to get a nice kind of abducted seated position, so we're not going to be as stable. Also, if it becomes quite severe, then it's going to be quite hard to position someone over their pelvis really nicely and securely. And it also will affect what kind of equipment's available to you if it becomes such an issue where you're not able to achieve certain positions. Same with standing as well. If we're in a lying position and our knees are really, and hips are really flexed over a long period of time, and we don't go through that full range of motion, then it might be not conducive for us to be standing anymore as well. So it's just something that's really important that we do need to think of in a robust 24-hour postural management plan. So also in terms of comfort, sleeping is so important. I think we all know the effects of having a good night's sleep versus having a really bad night's sleep, and how it affects our the rest of our day, of how we function. Also in terms of things like how our bodily systems work. A lot of people that don't sleep well have issues around bowel movements as well. So somebody with complex disabilities, if they're not getting good sleep and prone to kind of constipation, it's only going to make those kind of issues worse and create more secondary complications. And also the inability to change a position. So if we're able to change ourselves at night, I mean, I know I'm personally one of the most fidgety people I know. If I'm not able to do that and I become that uncomfortable, it will really affect how well I'll sleep. So it's something to also consider with the people that we look after. So this next slide is just depicting really the idea of gravity bearing down on us on a flat surface. So as you can see in the top part of the image, we've got loads of gaps underneath the legs and underneath the lumbar and thoracic region of the spine. So if pressure is constantly pushing down on us there, you can see that our ankle and our kind of pelvis, the backs of our head, our shoulders, they're going to be taking most of the pressure. And if we're there for a very long period of time, that's a lot of pressure to be bearing down on those individual areas. So you can see underneath here that there's a bit of profiling that's going on to really fill those gaps and support the full amount of the limb. And what that's doing is offloading all of that pressure and making it more or less risky that person will develop pressure-related problems. Now, if we take a look at taking those principles of stability and applying it to lying, so you may feel that lying should be fairly straightforward. It's a very flat surface and it's a very flat position, so not a lot can go wrong. However, we still need an amount of balance to be able to hold a lying position, or an effective kind of aligned position especially. So the first thing that we obviously need to think of is the pelvis, so as it's the keystone of everything we do. So if we take first of all the position of lying on our back in supine, we want to support the pelvis laterally, so either side of the pelvis. So that's really going to stop any rotation or any kind of obliquity of the pelvis of it coming up. So we get that in a nice formed position. We then want to control the trunk as well, because everything that happens to the pelvis will happen to the trunk. So it might be that person's got fairly good trunk control and they won't need so much support, but it might be that they need some lateral support around their kind of thoracic regions. If someone's prone to leaning and creating a bit of a scoliosis, over time, if they constantly are in that position, then it's more likely that would form. So we might need some lateral positioning up the thoracic region. Now, if we're in a side lying position, it's a slightly different. So the first thing that I want to talk about in side lying is, wherever possible, if we can lie someone at a slightly 30-degree angle. So what that will do is offload a lot of weight. So if we think of how we might sleep on our side, all of the pressure will be going down one lateral side of the body, whereas if we slightly turn that to 30 degrees, not only is the pressure going through the side of the body, but it's going through the entirety of the back as well. So again, it's offloading that pressure. But also what that will do is if we're supporting the pelvis, so this time we'll be supporting around the sacrum, if we just supported there and left everything else kind of to do what it wants to do, naturally the shoulders are going to rotate one way. They're either going to come forward or they're going to come backwards. And what that does is it creates rotation in the spine, which can lead to other kind of secondary complications as well. So we need to support the kind of the shoulder girdle and the pelvis at kind of the same position. And wherever possible, we need to fill in those gaps as well in between to really disperse that pressure evenly. So wherever possible, we need to contour around that person's back. Now, it might be that you can't get that 30-degree angle and you might have to be in a completely side-lying position. It might be due to comfort. That might be kind of a habitual way that that person may sleep. So in that case, we want to support the back of the pelvis around the sacrum and the shoulder girdle, but we may need a counter force on the kind of anterior side of the body. So that might be in a different position for depending on the person. So it might be sternally, it might be a little bit lower in the abdomen. It all depends on that person. Maybe they have a kind of a peg site where they're being fed and we need to avoid that. Or they might have some respiratory issues, so putting pressure on the sternum is not appropriate. So once we have created that stable base, we then can look at what's happening below. So we can take a look at the feet and the legs and the ankles. So if we go again from the supine position where we're lying on our back, we need to make sure that those gaps are filled. So we don't want all of the pressure going through the ankles and the kind of the bottom area. We want to fill those gaps. So depending on the person's ability to extend their legs, we may need to look at maybe a T-roll where it's going to support under the knees more. It might be that we just need some pillowing to really fill in those gaps so that the pressure's being nicely dispersed everywhere. Now, it might be also that the person may internally or externally rotate their legs too much. So we might want to think about any support that's going to go down the lateral side of the legs or the medial side of the legs on the internal bit. And it's really important to support the full limb as well, especially if we are kind of lifting the legs slightly. So if you think about supporting the full leg and then we've just left the ankle to kind of dangle off the end of the support, what may happen from that is that our feet become pointed in a plantar-flex position, and over time again that can form a fixed plantar flexion, which would then mean that person would find it really difficult to be in a standing position because they're on their tiptoes, and even in seating they might not be able to get foot plates that are kind of suitable for themselves. So it's really important to support the full limb and to support that ankle joint, especially in a nice, wherever possible, 90-degree position as well, so just to maintain that full range of motion. Also, if the person requires a bit more abduction, so if the legs are adducting or coming past midline, we might need to think of having some form of pommel in between the legs to promote that abduction. And similarly, if a child or a young person adducts, so the legs come out far too much, we need to think of supporting that externally around the lateral side of the leg to come back into more of a neutral position. And finally, arms and heads again. Some of the things that we really need to consider here is around kind of the face. Obviously, if we're in a side-lying position, we don't want anything that's going to come into contact in a negative way with the mouth and nose and restrict any breathing or anything. So we need to be really mindful of that, or any supports that's going to be in the way there. We also need to be aware of if we've got active movement in a lying position. So it might not be just for a sleeping position, it might be a therapeutic position, of how we can create that kind of midline position to allow those movements to happen. So just some key points to think of in a lying position. First of all, side lying versus supine. Obviously, a supine position is a lovely aligned position, and it's kind of the go-to in a lying position wherever possible. However, I mean, myself, I can't sleep on my back. I wouldn't be comfortable. I would not have a good night's sleep. So I prefer to sleep on my side. So having an idea of maybe both of those positions and rotating throughout the night, or working within in that kind of that individual's comfort zone as well, is really important. Wherever possible, to encourage that 30-degree lean into a side lying position as well, because what that also does is it allows the closest arm to have a little bit more freedom as well. So you probably fallen to sleep on your side before, and your arm's gone numb and it's fallen to sleep because all of our pressure's been going through through that arm. Somebody with complex disabilities may not be able to tell you that that's happening, and they might be very uncomfortable. So another kind of good reason of why to have that 30-degree lean. Also, just to make sure that any supports that are being used aren't going to affect someone's function and independence. So if someone can move themselves in their bed, for example, and having supports there is going to stop them from doing that, then it might not be the right thing to be doing for that individual. Comfort, is it comfortable? Will that person sleep? So that's also really important. I think introducing anything into someone's nighttime routine is going to change it, and it's going to be a bit of a learning curve, but making sure that it's not going to detract from their comfort, because we all know how important that is to get a good night's sleep. Is the system that you've chosen and the supports too complex? So just to give you an example of a situation that I was in, I went out to do an assessment for a sleep system with a physiotherapist and a fairly complex young person. And it took us probably a good hour and a half to trying different positions to find a really optimal, perfect position for this one individual child in a side lying position. However, we'd used so many supports in place that it would have been just unrealistic for that family or the carers of the family to really maintain that position every night using the supports in the way that we had. So it needs to be engaged with the whole family and the whole caring team. So it might be that we might need to compromise at first the optimal position for introducing a sleep system. So just supporting maybe the pelvis and the trunk at first may be a good stepping stone to then integrate further supports within the kind of the weeks and months as you go on. So I think that's a really important point to make, that jumping in kind of deep end first may not be the way to go with the sleep system or nighttime positioning. Little but often increasing is probably the way to go. And also whether that person needs to adopt multiple positions each night, and if you are choosing to go with a sleep system, you might want to think about which sleep system can create those different positions that you need to create. So in summary, let's just remind ourselves of the 3 characteristics of stability and how we've taken them into each position there. So we need to create that wide base of support. We need that centre of mass low to the ground and within that wide base. The pelvis is the keystone of everything that we do postural management wise. So whenever you're positioning someone, always start with the pelvis, because it affects what happens above and what happens below. Let's also remind ourselves that positioning, it always must meet the 3 aims of postural management. So we're always looking to minimise damage, increase function and independence, and reduce that fatigue. Lie well to sit well. That's something that's really important to remember as well, that nighttime positioning should really be looked at within a full 24-hour robust postural management system. And also the clinical benefits of having that postural management plan, and the fact that it's going to reduce the likelihood of coming across those secondary complications that we went through in the presentation before. So I hope you had some use out of that presentation. The final one of this series, we're going to look at assessing for posture, and we're going to look at some of the tools that we've got for you guys to help you when you are assessing those people that need postural management. So thanks again for your time, and I look forward to doing the last video. And I hope that you are getting much use from this. Thank you.